Now that we have an understanding of the effect of stress on the mind, let's talk about the effects of the stress hormones on the body. Please remember that the same hormones are affecting the mind and the body. And this is important because anything that we do to keep ourselves calm, to keep the concentration of the stress hormones low, will have a beneficial effect on the health of the mind and the body. It's the same hormones that are causing the alterations of health. So hopefully you'll be motivated to want to engage in procedures and techniques which keep the hormones low for the improved quality of health of your mind and body. One of the things that an elevation of stress hormones does is to raise your blood pressure. What happens if this is a blood vessel that's in a person without a lot of stress? It's nice and big and round. When the stress hormones go up, the blood vessel constricts. It becomes more narrow. And when that happens, you're squeezing blood into a smaller space. And anytime you squeeze a liquid into a smaller space, the pressure inside those tubes, inside the blood vessels, must go up. Stress causes high blood pressure. If you can get the concentration of stress hormones down, blood vessels will relax, they'll become wider, and blood pressure will drop. One of the risks of an elevation of blood pressure, of course, is having a stroke. If there's a blood vessel in the brain that is slightly damaged, is not totally intact, has a weak spot in it, and the blood pressure goes up, it's possible that that blood vessel in the brain will start to leak, rupture, and that would be a stroke. We want to keep our blood pressure down, and increasing our ability to cope with stress will keep our blood pressure down, help to keep our blood pressure down. Another thing that the stress hormones do is accelerate the development of heart disease. Now we're talking about what we call atherosclerotic heart disease, and atherosclerotic heart disease is the accumulation of cholesterol into the walls of the blood vessels of the heart. What happens is that when the stress hormones go up in concentration, they change the lining of the blood vessels of the heart, and a molecule that is just like Velcro is placed onto the walls of the blood vessels. This Velcro-like molecule binds to a type of white blood cell that then sticks to the walls of the blood vessel, and this white blood cell carries cholesterol into the walls of the blood vessel. So more stress hormone, the blood vessels become stickier, cells, white blood cells, bind to them that carry cholesterol into the walls of the blood vessels. Heart attacks. The stress hormones can cause one to have a heart attack. For example, have you ever heard of somebody experiencing stress and dropping dead of a heart attack? What happens is that in our blood we have tiny little things floating around called platelets, and these little things float around unattached to each other. When the stress hormones go up, the blood platelets stick together. And when they stick together, they form clumps. And if a clump of these platelets comes to a blood vessel in the heart that's been narrowed by cholesterol, it may plug it up, and if it does, that will be the heart attack. Now, in regard to cholesterol in the walls of the blood vessels of the heart, there is evidence that if we can keep the concentration of our stress hormones low, that the amount of cholesterol will be reduced in the walls of the blood vessel. If that occurs, the blood vessel will become wider, and if it becomes wider, there is a reduced risk of having a heart attack. So the question to you is, when do you want to start lowering the concentration of your stress hormones to reduce the risk of a heart attack? Do you want to wait until after you've had the heart attack and then start doing it? Or do you want to start now? And the obvious answer is you want to start now. This is a picture of blood vessels from the heart of monkeys. Now, these monkeys were living in the same housing condition. They also were eating the same diet. So where they lived was identical, and what they ate was identical. This blood vessel here is showing cholesterol accumulations in the blood vessel and a thickening of the wall of the blood vessel. This blood vessel here, very little cholesterol, a very normal looking artery. So if they were living in the same housing condition and they were eating the same food, what's the difference? And the difference is that the blood vessel from this monkey, the one on the left, was a monkey that was under stress. This was a monkey that essentially was picked on and beaten around by other monkeys. This blood vessel is from a boss monkey. This was a monkey that did not have a lot of stress. So this raises the question, if they were eating the same food and living in the same housing condition, is diet or stress more important to the development of atherosclerotic heart disease? And the best evidence and the bulk of the evidence today is saying that stress is much more important than diet in regard to the development of atherosclerotic heart disease. Stress is more important than diet. Another motivation to want you to increase your ability to cope with stress. Remember, we can't remove stress from our lives, but what we can do is change our brain so that it has less of an effect on activating the brain, and therefore the stress hormones will not be elevated as much. Another thing that the stress hormones do is change the way the immune system works. And they change the immune system so that it is less capable of fighting off bacteria and viral infections. Did you ever notice that when you're under stress, you're more likely to get a cold? And that's because the immune system is less capable of fighting off infections. It's important to point out here that if you're going for an immunization and you're under a lot of stress, you're better off waiting and going when you're not under a lot of stress, because the response to the immunization is reduced when you get immunized and you are under a lot of stress. Autoimmune diseases are diseases in which the immune system attacks the body. When somebody has an autoimmune disease, a disease such as psoriasis or multiple sclerosis or rheumatoid arthritis or ulcerative colitis or Crohn's disease, experiences stress, the likelihood of the disease getting worse, and if they're in remission, the likelihood of the disease exacerbating increases. Stress increases the likelihood of exacerbation and clinical course, severity of the clinical course of autoimmune diseases. If someone has an autoimmune disease and they increase their ability to cope with stress, so the stress hormones are being lowered in concentration, the likelihood of the clinical course of the disease being reduced increases. Asthma and irritable bowel syndrome. These are diseases which stress tends to exacerbate. People with asthma, when they are under stress, may have a worsening of disease, a narrowing of the airways in the lungs. People with irritable bowel disease may have worsening of disease. Also, people with fibromyalgia or chronic fatigue syndrome. Stress may be a factor in the clinical course of those diseases. Wound healing is another area where the stress hormones have an effect. If you have a cut, the stress, and you're under a lot of stress, the rate of healing of the wound, of the lesion, is decreased. When our stress hormones are low, wounds, cuts, scrapes will heal more rapidly. Diabetes is another disease affected by stress because one of the stress hormones, cortisol, converts fat to sugar, converts fat in the liver to sugar. And people with diabetes who have high levels of stress will have more difficulty managing their diabetes than people who increase their ability or have the ability to cope with stress. Indeed, the level of hemoglobin A1C, a measure of the glucose levels in a person over the past several weeks, will decrease when an individual with diabetes engages in stress coping behaviors. Can weight management be affected by stress? Sure it can. As we said earlier, talking about the effect of stress on the brain, if you're not thinking clearly and you're not focusing, and now you're getting hungry and you want to you go to the refrigerator and there's something there that maybe not the healthiest to eat, but it's going to taste good. Well, if you're not going to make a clear decision, you're going to eat it. Focusing, thinking clearly will help you to make decisions about what not to eat. Also, cortisol increases the amount of fat around the abdomen, around the belly. And when the amount of fat around the belly increases and gets larger, there is an increased risk of developing type 2 or insulin independent diabetes. So stress does affect health, does affect weight management, and the important thing is that you want to be able to think clearly, so you want to keep your stress hormones down. Telomeres. Now we're getting a little bit complicated here, and something which is not a part of our normal conversation. But let's talk about this because it's important. The telomeres are the protective components. They're little caps on the ends of your chromosomes. And when they are there and when they are doing their job, they stabilize the chromosomes. They keep the chromosomes from essentially decreasing their function and not doing what they're supposed to do. Each time a cell divides, the telomere, the cap on the end of the chromosomes, gets shorter. If they get too short, the cells will stop dividing and tissues and organs wear out. Your tissues don't function as well. They don't do the jobs they were intended to do. Your liver clears the blood of material which can make you ill, cause mental diffusion. Your kidneys remove substances from the blood that when in too high a concentration can cause disease. These are some examples of what happens when tissues wear out. Short telomeres have been associated with an increased risk of developing cancer, dementia, and shorter duration of life. So basically, we want to keep our telomeres long. What can we do to keep our telomeres long? Well, cortisol, one of the stress hormones, causes telomeres to shorten. Therefore, stress will be associated with shorter telomeres and an increased risk of disease development. And what do we do to keep our cortisol low? We're going to use the behaviors and techniques that we'll learn about that lower the concentration of stress hormones. And when the cortisol is lower, telomeres will be longer. Now, telomeres are not something that you regularly think about, but I want you to know this. It's important because we want to do all the things that we can to keep ourselves healthy. And all the things that we can, look, if you keep your stress hormones low, you're going to affect your mental health, your physical health. You don't do one thing, one behavior to affect one organ. You keep your stress hormones low and all the health benefits result. The final medical condition I want to talk to you about is inflammation. Now, let's use an example of inflammation. That's when you get a splinter. And when you get a splinter in the skin, what happens is the area becomes red, warm, swollen, and may actually accumulate some pus, which is white blood cells. And the white blood cells go to where the splinter is to remove any bacteria that are there. And when they remove the bacteria, the inflammation goes away. So that's an example of inflammation. But we're also familiar with the word inflammation because many people purchase anti-inflammatory medications for when you have mild aches and pains. And what do you do with these mild aches and pains? You take an anti-inflammatory medication, and often it works. So we're very, very familiar with this concept of inflammation. And if somebody has a disease such as rheumatoid arthritis or ulcerative colitis or Crohn's disease or psoriasis, these are diseases associated with inflammation where white blood cells accumulate in tissue. And these diseases, part of their treatment is to reduce the amount of inflammation in the tissue. Now, the process of inflammation not only involves white blood cells, but involves chemical molecules that are called cytokines. And these molecules are released into the blood during the process of inflammation. Let me give you an example of this. When you have an upper respiratory infection, how do you feel? You feel tired, down in the dumps, achy? Well, these feelings of tiredness and being down in the dumps and achy are caused by cytokines. And these are the cytokines released from the immune system when it's fighting off the viral infection, when it's fighting off an upper respiratory viral infection. And when the infection is treated, these cytokines go away and we feel fine again. So inflammation is a process that affects tissue, but also can affect our brain. The cytokines that are part of inflammation can have an effect on our brain. Now we know that prolonged stress, chronic stress, can cause a sustained elevation of cytokines in the blood. These are the same chemicals that are involved in inflammation. And the point is that it doesn't have to be a bacteria or a virus or some damage to the tissue that can cause an elevation of cytokines, but chronic stress can do this. And we tend to use the term sterile inflammation because there's no infection or disease associated with this. And with a sustained elevation of cytokines, and stress will cause this, we feel tired, we don't have much energy. We tend to walk slowly, we feel weak, we don't want to be active, we just want to lie around. But there's also an increased risk with sustained elevation of cytokines with development of malignancy and heart disease and diabetes, osteoporosis, and inflammation in people who have sustained levels of cytokines, high levels of cytokines for long periods of time, there appears to be an association with shorter length of life and health. And very importantly, these elevated levels of cytokines, which are markers of inflammation, although it could be sterile inflammation, it doesn't have to be an infection, are associated with depression. And lower levels of inflammation are found in individuals who are physically active. You want to be active, socially interactive, having friends, joyful, happy, and cope well with stress. We want to keep the levels of inflammation low. And the diet of fruits and vegetables and nuts, kind of the Mediterranean diet, helps to contribute to lower levels of cytokines and less inflammation and better feeling of mental and better quality of mental and physical health. So we've talked about a lot of things that completes section 4, how stress affects the body. So now we know how stress can affect the mind and the body. Now we'll go on to section 5, where we'll learn how the use of behaviors that we can engage in will reduce the effect of stress on mental and physical health, because using these behaviors will change the way the brain responds to stress. Using these coping skills, the brain will be less responsive to stress, so when you perceive something as stress, there'll be less activation of the stress reactive brain areas and less of an elevation of stress hormones.